Video, let's understand more about this particular condition called as Broca's aphasia. In the series of stroke recovery and rehabilitation, we are coming up with educational videos that will help you to understand some common impairments that you suffer related to your communication when it comes to stroke. And one of this video is today's video where we are understanding in detail Broca's aphasia. So let's get started. Friends, Broca's aphasia is also called as a non-fluent type of aphasia, which means that a person is able to understand things, but when it comes to communicating, the fluency is missing in multiple ways and forms. Patient will find difficult to express his thoughts, his ideas via communication. Broca's aphasia majorly happens due to damage in the Broca's area, which is present inside your brain in the dominant side of your frontal lobe, due to which there is challenges in communication like difficulty in production of speech, effortful speech, halting in middle, and grammatical errors while making sentences or phrases. Speech significantly gets slow when it comes to Broca's aphasia. The person very commonly omits words in a sentence, which leads to grammatically wrong or incorrect sentence formation. Patient also have a significant impact in its ability to repeat words and phrases. That's not all. Writing is also affected or impaired when it comes to Broca's aphasia. But since the comprehension is intact, patients are aware of these challenges, which leads to emotional burnout, frustration, and mental health issues as well. So, when it comes to Broca's aphasia, rehabilitation is the key element when it comes to management. So, how this rehabilitation needs to be done? Well, speech therapy is the first line of treatment when it comes to Broca's aphasia management. In speech therapy, the initial emphasis is on re-establishment of articulate mnemonic production and progressive moving to more complex articulation skill sets. Approach of rehabilitation has to be impairment based, where different patients will have different impairments related to their speech. They need to be prioritized, and the rehabilitation protocol needs to be personalized and designed based on that, such as naming sentences. For example, some patient might have challenge first with naming. For few, it would be the problem with the phonation part, and for few, it would be problem more in the phrase formation part. So, based on the particular need of the patient, the impairment needs to be categorized, should be prioritized, and that's how the therapy needs to be implemented. Approach has to be 100% participation based, which means the treatment has to be two-way and not one-way, where the therapist is only doing stuff and the patient is just passively taking the therapy. In that way, the therapy or rehab will absolutely fail. That's why involvement of patient at the same time caregiver is very critical. It's not just the therapy that requires support. The support of therapist, caregiver, and patient involvement not only creates a positive environment, but acts as a very big motivational source for the patient that pushes him or encourages him or her to go towards recovery. There are some important rehabilitation techniques which are purely backed by evidences that can be implemented in the right, that when implemented in the right way at right time gives amazing results. What are these evidence-based methods that are used? What are these evidence-based methods that can be used to improve the speech-related challenges when it comes to Broca's aphasia? Here, the number one is orofacial and linguomotor exercises. Facial exercises is not just for speech production, but improves the expression practices. Facial expression is not just about sound production, but it's about making those micro movements on the face. That helps a patient to communicate in a better way. This is a very nuanced technique, but when applied in the right way, empowers the patient to communicate whenever he is short of words. At the same time, orolinguistic exercises encourages patient to develop his language area in the brain and help the patient to find that right sentences and words that he needs to communicate in his or her day-to-day life. Repetition drill is the second most important aspect. When it comes to stroke rehabilitation, neuroplasticity is the key concept that is being used in across all the methods that is there. Repetition drills not only builds stronger connections inside the brain, but at the same time improves patients' confidence in using right words at right time to get better communication outputs. The third method is object naming. This can be implemented using various methods like flashcards, memory games, etc., which helps the patient to identify stuff that he or she uses in day-to-day life, build association with the phrases that he or she needs to use, and thus eventually improves the speech production. The fourth one is melodic intonation therapy. Our brain, when uses music as the source of communication, it responds very well. And that has been found in that has been found in many studies till date. Melodic intonation therapy uses humming technique or speaking with the help of sound tunes, which encourages the patient to communicate in far more better way. This technique is very effective, very easy to follow and use at home. And thus, it's a favorite part of therapists. The next is constraint-induced language therapy. This particular method is used in the progressive stages where the complexity of the exercises has to be increased and the patient needs to be trained to participate in complex communication tasks. Similar method is semantic feature analysis and structured cued approach. Here, different cues, prompts are used to help and encourage patient to communicate in the right way and retrain the patient to use these cues and methods in his or her day-to-day communication tasks. The seventh method is a visual support, communication board, flashcards, written words, gestures, hand support. These are some simple but very important visual cues that encourages the patient to communicate in the right manner. Next is mental health and adaptive strategy. As I mentioned, a patient who suffers from Broca's aphasia has got a very intact comprehension. He or she understands his or her own challenges. And that's why this could be a reason of burnout, frustration, anger, anxiety, and other mental health issues as well. Working on this hand in hand is equally important. And that's where mental health practices with the help of cognitive behavioral therapy plays a very critical role. The next evidence is about physiotherapy. Yes, physical therapy works on the physical aspects of the body. It's not just the face, it's the neck muscles, it's the facial muscles, it's the expression muscles, it's the hand movements, the ability to use the hand in the proper way that helps the patient to communicate better. Because remember, at the end of the day, communication is not just sound production. It's as a whole an individual who uses its different aspects of body to just share that expression and emotion that is there inside the mind. Last but not the least is environment modification. You see, environment plays a very critical role as a motivator, as an enabler, and as an influencer in how the patient will recover and in what direction he or she will recover. That's why environment modification is also a very critical or subtle, but most of the time an ignored aspect when it comes to stroke rehabilitation. So these were some simple but very powerful evidence-based methods that can help in Broca's aphasia rehabilitation. Now, what's the prognosis or timeline of recovery? Well, if we look at the research papers and articles that has shown outcomes related to Broca's aphasia, they have showed a significant improvement in patients with proper rehabilitation after 2 to 6 months of the stroke. After 2 to 6 months of the stroke onset. This can continue much longer or much shorter depending on further factors. For example, lesion size, the location where this lesion happened, what was the pre-stroke status of the patient, what is the patient motivation, how is the caregiver support that's present around the patient, are there any coexisting deficit, and is there any access to therapy that the patient can use it on a regular basis to work on its recovery. With these factors in mind, the prognosis will be determined. So in summary, Broca's aphasia requires a structured, multidisciplinary, and a consistent rehab approach, which has to be 100% patient-centered, personalized based on patient's impairment and the priority of communication. Both language retraining and functional skill equally needs to be given importance when it comes to rehab. And it has to be a multimodal approach, which means it is not just about speech therapy, but in combination, adding physiotherapy, cognitive behavioral therapy, and sometimes occupational therapy as well to get the best outcome for the patient for recovery from stroke. So friends, at HealthQ Rehab, we have come up with a program which is called as Reconnect One-on-One, which is a complete stroke recovery program which uses a multimodality approach, which means we combine speech therapy, physiotherapy, cognitive behavior therapy, nutrition, and important aspects that is important and very critical for stroke recovery to help stroke patients. These programs can be implemented virtually at the same time offline at our center, which is located in Bangalore. If you who are someone who has a loved one who is suffering from aphasia, and if you want to know more about it, feel free to reach out to us by visiting our website www.healthqrehab.com. Book a consultation so that we can analyze and let you know how much we would be able to help you. I hope this video was informative for you. If you have any specific questions related to stroke recovery and rehabilitation, feel free to mention that in the comment section below. On that note, I'll end this video here and I'll see you in another video. Thank you.